maintains the clinical data, diagnostic registries, and records of patients receiving rehabilitative treatment within public health facilities. So when we get that information from the ministry, we'll bring it here. If the ministry is not able to provide that answer, I would also request this House, with your powers, to also request the Ministry of Health to provide such data so that we can have that information clearly for the country, as requested by Senator Catherine Muma. On the second question about long-term strategies, the Ministry, through the National Council for Persons with Disabilities, has developed a number of strategies to enhance affordable access to assistive devices and technologies as follows. We have created a partnership, and let me say, first of all, the ministry has been very heavily underfunded. I was with my PS here, Bwana Motari, very, very good Principal Secretary, and we've been talking about the things we'd like to do, especially for our people who are disabled, but the cash is not there. The money is always underfunded. We have created partnerships with key stakeholders and players in assistive technologies to provide assistive devices. These include APDK, Hope Mobility Kenya, and Bethany Kids, and at AT scale. We have developed a catalog of assistive devices to be tax exempt during importation, hence reducing their cost. And we are lobbying for the inclusion of more assistive devices and technologies in the list of items to be covered by the social health insurance. I submit, Mr. Speaker.
Senator Catherine Muma, do you have any supplementary question?
Yes, Your Honor.
You may proceed. You may proceed.
Honorable Speaker and Senators, the response by the CS exposes clearly the fact that the government is not working as one. Honorable Speaker, I'm disappointed that the CS in charge of taking care of needs of persons with disability does not have data in respect of a category of persons with disability. In fact, he's throwing away and saying that the responsibility belongs to the Ministry of Health, and telling us that he has asked the Ministry of Health to give him this data, and if the Ministry of Health does not give that data, that we as Senate should assist him to get that data. A very clear show that Article 10, in respect of including persons with hearing disabilities, is not being implemented in this ministry. And that calls to question, what tools, CS, do you have to actually assist you to plan for categories of interest groups that you're in charge of? Clearly, from that answer, you don't seem to have any such tools. In the second one, the CS has given a vague answer about not having adequate budget and trying to partner with key players whom he does not mention. And again, showing clearly that the government of Kenya, as the primary duty bearer to these persons with a disability, is clearly not recognizing this role. So I would want to know, who is it, Honorable CS, do you hope will create a budget, and where, in order for the needs of persons with hearing disabilities to be included as equal Kenyans, requiring to access services, whether of SHA or of these devices, as other Kenyans, as obligated under Article 10 of the Constitution of Kenya?
Senator Mbugua.
Thank you, Mr. Speaker. Mr. CS, according to the World Health Organization, 40% of hearing loss is preventable with early detection. What specific programs is the government implementing to help these people so that we can save the 40%? Thank you.
Senator Manzo.
Yes, Mr. Speaker, the hearings problem in Kenya is caused from work sites, either construction sites or construction of dams where they do blasting, like it happened in Twake Dam, or, Mr. Speaker, accidentally when a rocket